Hello, I'm Dr. Collins, and in this examination video we are going to take a look at two helpful special tests that are used in the assessment of shoulder pain, the drop arm test and the empty can test, also known as the Jobe's test. When used together, these two special tests can be super helpful in identifying tears in the supraspinatus muscle, which is the most commonly affected muscle in rotator cuff injuries. Speaking of rotator cuff injuries, here is a great time to remind ourselves of what the four rotator cuff muscles are with a well-known mnemonic SITS. S for supraspinatus, which is the one we are interested in this video. As we mentioned, it is the one that is most prone to becoming damaged. A, because of its anatomical position, as the supraspinatus tendon passes through a narrow space called the subacromial space, and also because of its function in abduction of the shoulder, which is the movement that enables overhead activities like throwing or reaching, which puts significant stress on the shoulder joint and on this muscle. I for infraspinatus and T for teres minor, both of which help with the external rotation of the shoulder. And finally, the second S for subscapularis, which is involved in the internal rotation of the shoulder. With supraspinatus tears, patients will often present with lateral shoulder pain, and usually after a traumatic event such as after a fall on an outstretched hand or a sports injury involving overhead activities. And the patients will report a degree of weakness which will be worse when they are trying to do their overhead movements such as lifting their arm or reaching. Although supraspinatus tears are not the only differential for shoulder pain, and other differentials should definitely be considered, such as impingement, frozen shoulder, or degenerative changes, these supraspinatus tears are very common, with a prevalence of up to around 60% in men and 35% in women. Identifying medium to large tears early and treating them appropriately, and remember the larger ones will often require surgical intervention, we can significantly shorten the lesion repair time and reduce the occurrence of post-treatment or post-operative complications. Before we go on to demonstrating the drop arm and empty can tests, here's a bit of information about their accuracy so that you can take these clinical examinations with a pinch of salt. The drop arm test has a sensitivity of up to 73% and the specificity of 77% in detection of supraspinatus tears. In other words, the test will correctly identify a supraspinatus tear in 73% of the cases, and it will correctly identify the absence of a tear in 77% of the cases. These numbers are derived from cases with full thickness tear. Therefore, the sensitivities and the specificities will be even lower if the patient has a partial tear only. For the empty can test, these figures are even lower, with sensitivities of around 69% and specificity of 62%. As you can appreciate, these numbers are only moderately high, and therefore using a combination of them increases your chances of avoiding false positive or negative outcomes. So, let's start with the drop arm test, and bear in mind that there are different variations for these tests, and we're going to look at one of those variations in each scenario. So, the drop arm test involves you taking your patient's arm and bringing it to a 90-degree abduction position passively. Then you will warn your patient that you will let go of their arm soon and ask them to hold it there for as long as possible. Normally, patients should be able to achieve this without any problem. If the patient is able to hold their arm up without any issues, the test is said to be negative. Whereas in patients with supraspinatus tears, especially if it is a large or full thickness tear, a positive test result will be observed with the arm of the patient dropping to their side in an uncontrolled manner as soon as you remove your support, and this is why the test is called the drop arm test, because in positive cases the arm simply drops. Next, we are going to demonstrate empty can or Jobe's test, which looks at both supraspinatus tears, but it can also pick up supraspinatus tendinopathies, such as impingement. In order to perform this test, you'll lift your patient's arm to a 90 degree in front of them, and then move their arm sideways to their scapular plane. Next, you will medially rotate their arm with their thumb facing down, and at this point it should look like they're emptying a can, which is where the name of the test is derived from. Next, you'll ask your patient to resist you pressing their arm down, and you'll apply pressure on their forearm on the ulnar side. A positive test is when the patient feels pain in their shoulder with supraspinatus impingement or a weakness with a supraspinatus tear, which will obviously once again be a lot more prominent if the thickness of the tear is larger. Thanks for watching. If you like this video, please like and subscribe. And remember, we also have many other medical videos and a free question bank in our website. Good luck!